Measles, the doctor who emptied vaccine clinics. One 12-patient study convinced parents on 2 continents to stop vaccinating their children. Andrew Wakefield was born in 1956 in Eton, England, the son of a neurologist and a general practitioner. He trained at St. Mary's Hospital Medical School in London and built a career as a gastrointestinal surgeon and researcher. By the mid-1990s, he had shifted his focus to a theory linking bowel disease to childhood vaccines. In February 1998, Wakefield published a paper in the Lancet examining 12 children. He claimed the measles, mumps, rubella vaccine triggered intestinal inflammation that led to autism. The paper included no control group. It relied on parental recall and a sample size smaller than most classroom rosters. Wakefield held a patent for a rival single-dose measles vaccine at the time of publication. He had also received £435,643 from lawyers preparing to sue vaccine manufacturers. MMR vaccination rates in the United Kingdom fell from 92% in 1996 to 80% by 2003. In some London boroughs, coverage dropped below 60%. Journalist Brian Deere spent 7 years investigating the paper's data and found it had been altered to fit the conclusion. The General Medical Council reviewed the case for 2.5 years, the longest disciplinary hearing in its history. In February 2010, the Lancet fully retracted the paper. In May 2010, the GMC struck Wakefield from the medical register, citing dishonesty and abuse of developmentally disabled children. He relocated to Austin, Texas, and continued producing anti-vaccine media. In 2013, Wales recorded 1,219 measles cases and 1 death during an outbreak in Swansea, concentrated among children born during the year's vaccination rates had collapsed. A single fabricated paper outlived its retraction by decades because fear spreads faster than correction. Typhoid fever. The cook who infected her employers. A woman with no symptoms was locked away for 26 years for a disease she never felt. Mary Mallon was born September 23, 1869, in Cookstown, County Tyrone, Ireland. At age 14, she emigrated alone to the United States and eventually found steady work as a cook for wealthy New York families. Between 1900 and 1907, she moved through 7 households. In 6 of them, residents fell ill with typhoid fever. In the summer of 1906, a banker named Charles Henry Waring rented a home in Oyster Bay, New York, and hired Mallon as his cook. Within weeks, 6 of the 11 people in the household contracted typhoid. Sanitary engineer George Soper was hired to investigate. He traced typhoid outbreaks across 4 other households back to Mallon's employment dates, even though she showed no symptoms herself. In March 1907, Soper confronted Mallon directly and requested stool and blood samples. She refused and chased him from the property with a carving fork. New York City health authorities forcibly detained her days later. Tests confirmed she carried live Salmonella typhi in her gallbladder. She was quarantined alone on North Brother Island starting in 1907. Released in 1910 after promising never to cook professionally again, Mallon changed her name to Mary Brown and returned to kitchen work within 5 years. In 1915, an outbreak at Sloan Maternity Hospital in Manhattan infected 25 people and killed 2. Investigators traced the kitchen staff and found Mallon working under her alias. She was returned to North Brother Island and confined there until her death on November 11, 1938, at age 69. She infected at least 51 people across her career and never once felt sick. Her body carried the plague her employers could never see coming. Philadelphia Parade. The parade that filled Philadelphia's morgues. A single afternoon parade turned one American city into the deadliest flu outbreak in the country. By September 1918, Spanish influenza had already reached sailors at the Philadelphia Navy Yard, with the first confirmed case logged on September 11th. Dr. Wilmer Cruzen, the city's director of public health, downplayed the risk publicly, calling it ordinary influenza. Physicians in the city urged him to cancel an upcoming Liberty Lawn parade meant to sell war bonds. On September 28, 1918, Cruzen allowed the parade to proceed. An estimated 200,000 people packed Broad Street for 2 miles, standing shoulder to shoulder for hours. Within 72 hours, all 31 hospitals in Philadelphia reported beds full. By October 1, 1918, an average of 254 people were dying per day. Cruzen did not close schools, churches, and theaters until October 3rd, 5 days after the parade and well past the point of containment. Bodies accumulated faster than the city could bury them. Undertakers ran out of caskets by mid-October. The city requisitioned steam shovels to dig mass graves at Potter's Field. Across 4 weeks, from late September through late October 1918, more than 12,000 Philadelphians died. St. Louis, by comparison, canceled its own parade and closed public spaces within 2 days of its first case, recording a peak death rate less than half of Philadelphia's. Cruzen faced no criminal charges and remained in his post until 1919. A parade meant to fund a war abroad helped kill more citizens at home than the war itself would claim from the entire city.